A ganglion cyst is a non-cancerous fluid-filled lump or swelling that typically forms along the tendons or joints of the hands, wrists, or feet. Although ganglion cysts are usually harmless and painless, they can cause discomfort or interfere with movement in some cases. Let's dive into the causes, symptoms, and treatment options for ganglion cysts, as well as natural remedies that may help manage them. What is a ganglion cyst? Ganglion cysts are benign, non-cancerous lumps filled with a thick, gel-like fluid. These cysts form when the tissue surrounding a joint or tendon becomes weak and forms a sac filled with fluid. Ganglion cysts are most commonly found on the wrists, back of the hand, or fingers, but they can also appear on the ankles and feet. The cysts vary in size, and while they are usually small, they can grow larger over time. Ganglion cysts are not harmful in most cases, but they can be unsightly or cause discomfort, especially if they press against nerves or muscles. Causes of ganglion cysts. The exact cause of ganglion cysts remains unclear, but several factors are believed to contribute to their development. Number 1, joint or tendon stress. Repeated stress or irritation of a joint or tendon can lead to the formation of a ganglion cyst. People who perform repetitive motions like typing or using certain tools are at higher risk of developing them. Number 2, joint or tendon injury. Trauma or injury to the affected area, such as a sprain or strain, may increase the likelihood of ganglion cysts forming. The cysts can develop as a result of the tissue's response to injury. Number 3, age and gender. Ganglion cysts are most common in people between the ages of 20 and 40. They are also more frequently found in women than men, although they can occur in anyone. Number 4, genetics. A family history of ganglion cysts may increase the likelihood of developing them. Symptoms of ganglion cysts. Ganglion cysts often present with clear signs and symptoms, although in some cases they can be asymptomatic. Common symptoms include, number 1, visible lump. The most notable symptom is a soft, rounded lump that can range in size from a small bump to a larger swelling. Number 2, pain or tenderness. While many ganglion cysts are painless, some may cause discomfort, especially if the cyst presses against a nerve. Pain can vary from mild to severe, depending on the size and location of the cyst. Number 3, limited range of motion. If the cyst is large enough or located near a joint, it can restrict movement and make it difficult to bend or extend the affected area. Number 4, change in size. The cyst may fluctuate in size, becoming larger or smaller over time. Some cysts may even disappear on their own. Number 5, numbness or tingling. If a ganglion cyst presses against a nerve, it can cause symptoms like tingling, numbness, or weakness in the affected area, such as the fingers or hands. Diagnosis of ganglion cysts. A ganglion cyst is typically diagnosed through a physical examination. During the exam, your doctor may feel the cyst. The doctor will assess the size, consistency, and tenderness of the cyst. Test for transillumination. This involves shining a light through the cyst. If the cyst is filled with fluid, the light will pass through, helping to confirm the diagnosis. Imaging. In some cases, your doctor may use ultrasounds or MRI scans to get a clearer picture of the cyst, especially if it's deep within the joint or if there's uncertainty about the diagnosis. Treatment options for ganglion cysts. Number 1, observation. If the cyst is small, painless, and does not affect function, your doctor may recommend simply monitoring it over time. In many cases, ganglion cysts will resolve on their own without treatment. Number 2, aspiration. Aspiration is a procedure where the fluid inside the cyst is drained using a needle. Aspiration is more effective for smaller cysts. Number 3, corticosteroid injections. In some cases, doctors may inject a corticosteroid into the cyst to reduce inflammation and swelling. This can help reduce pain and discomfort, although the cyst may still return over time. Number 4, surgery. If the cyst is large, painful, or causing mobility issues, surgery may be recommended to remove the cyst entirely. Surgery is usually a last resort when other treatments have not been effective. Home remedies for ganglion cysts. Number 1, warm compress. Applying a warm compress to the affected area can help reduce pain and inflammation. Heat therapy can also increase blood flow, which may promote healing of the affected tissue. Number 2, Epsom salt soak. Epsom salt contains magnesium, which has anti-inflammatory properties that may help reduce swelling and pain. Soaking the affected area in warm Epsom salt water can be soothing and may promote healing. Number 3, aloe vera gel. Aloe vera has cooling and anti-inflammatory properties that may help reduce swelling. You can apply aloe vera gel directly to the cyst to soothe the area. Number 4, turmeric. Turmeric's curcumin fights inflammation, reducing ganglion cyst swelling and pain. Apply a paste or use supplements and tea for relief. When to see a doctor. Although ganglion cysts are typically harmless, you should consult a doctor if the cyst becomes painful or grows rapidly, you experience numbness, tingling, or weakness in the affected area, the cyst interferes with your ability to move the joint or perform daily tasks, you are concerned about the appearance or size of the cyst. Ganglion cysts are common and generally harmless, but they can cause discomfort or restrict movement in some cases. If you have concerns about a ganglion cyst, it's always best to consult with a healthcare provider for proper evaluation and treatment.